Hello, my name is Carly Ripton. This is for VTHT 2439 for veterinary nursing for the spring 2020 semester, and this is my first set of AVMA task videos.
Okay, we're going to be doing our lung and heart auscultation here on Heidi. So we're going to be listening for different sounds in her lungs, such as wheezing or crackling. Those can indicate that she may have a type of lung disease or if she's having any issues with breathing. And we're also going to listen to her heart. For that, we want to listen for any heart murmurs. So that kind of is like a swishing sound. Sometimes it's described as when you put your shoes in a dryer, that kind of noise that it makes can be heard. So when you're listening to the lungs, you're going to listen to 9 different quadrants on both sides, and you're going to listen for a total of 2 breaths. Alrighty, so we're going to listen to 9 different quadrants on Heidi's lung here to check for the upper and lower airways. And we're going to check those for 2 beats per minute. That side sounds good. Alrighty, so Heidi's lungs sound nice and clear. Alright, so we are going to go ahead and listen to Heidi's heart, and while we do that, we're going to count her beats per minute so we can give that information to our doctor. A way to do that is you want to count that within 60 seconds. There's a couple different ways to do it, but we like to do it by, you're going to count how many beats you get in 6 seconds and then multiply that by 10 to get the total there. Alrighty, so we are going to go ahead and turn Heidi with our head towards this way so we can listen to her heart. We're going to listen right behind her left elbow here, and we're going to listen for 6 seconds, which we have on our watch here. Alrighty. Yep. So she had 8 beats in that time, so her heart rate is 80. So we also want to go ahead and check her femoral pulse. So we're going to locate that with our fingers back here. And we want to make sure that the beat is consistent with her heart rate. Alrighty, so I'm also getting 8 beats there, so it is consistent with her heart rate. Today I'm going to be demonstrating how to use a rabies poll. So you use a rabies poll typically when you have a patient that has an unknown vaccination history and you are suspect that it could have rabies. You want to do that to keep everybody in the vicinity safe. Also, if you have an animal that's really aggressive and you need to keep them at an arm's length from you, we also use these. So the way to use the rabies poll, we have our loop here. You'll place it over a pet's head. You'll pull back and tighten, and then you can lead them such. And then to release it, you push through and pull it off of their head. Alright, we are going to do our rabies poll demonstration on Heidi here. So we're going to take the loop, place it around her neck, and tighten it just like that. And then we can control her with it. And then when we want to loosen it, we will push out and slip it back over her head. Okay, today we're going to show how to properly disinfect and clean a kennel. So we have our kennel here, and we have our disinfectant. We use Sentinel here at our hospital. So what you're going to do is you're going to spray the sides, the bottom, spray up on the top. You're even going to spray your cage door. Alrighty, and then we're going to let that sit for 5 minutes and come back and clean it. Okay, so we've had 5 minutes for our disinfectant to sit, so we're going to go ahead and wipe it down. So when you want to wipe down your cage, you want to start from top to bottom with the sides. You're doing that so that if you you're not moving hair around on it. So if the bottom of the cage has a lot of hair on it and you're wiping from the bottom up, you're just moving that hair up the cage. So we're gonna start from the top down. So we'll get there. Bottom, and you want to go ahead and start from the back and bring it out in front here. Alrighty, and then you just want to wipe your cage door down, outside, inside. Same on the front. Get everything, and now it's properly disinfected. All right, today we're going to be doing anal glands on Heidi. So anal glands sit right behind the opening of the anus at about 8 and 4. So we have our gloves on. We're going to put lube on our fingers, and we've got our paper towel here to catch anything that comes out. So we're going to go in just enough. Alrighty, and they are small. They feel like grapes or blueberries depending on the dog. So you're gonna put a little bit of pressure, and you can see we're getting some out there. And you wanna milk that. Alrighty, and then you're gonna switch to the other side. Use your thumb to milk that side out. Alright, so they're easily expressed a little pasty. So we're gonna go ahead and wipe that off, and then we're gonna take our paper towel here with our cleaning solution on it, and we're going to go ahead and clean Heidi up. And there we are. All right, we're going to be applying our topical medication to Basil here. We're going to be applying his Revolution Plus, which he gets monthly. So when you apply topical medication on a dog or a cat, you want to make sure that you part the hair so you get down to the skin. Specifically on a cat, you want to make sure that you get up as far as you can on the base of the neck to the beginning of where the skull attaches, so that you can make sure that they can't get around to lick it since they have a wider range of motion. So we have our medication here. We're going to part his hair and apply that there. Make sure we're getting down to the skin, and it's in a location where he cannot lick it. Alright, today we're going to go ahead and be cleaning and medicating Heidi's ears. So Heidi's a dachshund, so she kind of has recurrent ear issues. So we're going to hold the ear back. We're going to take our ear cleaner and put a little bit in there and kind of mush that around. You get down there deep. We're going to take a clean gauze here and wipe her ear out. All right, we want to do gently, make sure that we get deep enough. So we have quite a bit of gunk coming out there. So we'll go ahead and do the other side here. Put a little bit down in there. Squish it down. Was it itchy? Yeah. Grab another clean gauze. Alrighty, and we'll just go ahead and put down in there. Alrighty, and get our stuff out. Alrighty, so now we're going to go ahead and let those dry for a minute before we put our medication in. We're going to go ahead and medicate Heidi's ears here. She has been prescribed Batril Otic, so she's been prescribed to get 2 to 3 drops in each ear. So we're going to go ahead and make sure we get in there. 1, 2, and we'll set around. Then we'll go to this ear. Make sure we're getting down in there. Alrighty. And 2, and we will push that around. Alrighty, and now her ears are clean. Alright, today we're going to be doing an ear cleaning and medicating on Basil here. So we have our ear cleaner, we have our clean gauze pads, and he is on Tresiderm, so we'll be using that to medicate. So for the cleaner, we're just going to take a little bit in there, rub it down, and take your gauze pad and get, go. It's got some debris in there. We'll wipe that out. Then we'll go ahead and medicate this ear also. Go. And we will set that down. then we will rub that one out. Alrighty, and then we're going to take our Tresederm. He's prescribed 2 drops in each ear. So we'll pull our ear back, get that right there. There you go, 2 drops. Rub that in. We'll go to our other side. 2 drops in this one also. And rub that in. And that will complete our ear cleaning and medicating. So this is Bert. He is here to be neutered. So we're going to go do a nail trim on him. So when you look at a canine's nail, depending on the color of it, the white nails, you can see where the quick is, which is the blood supply. So that's going to be right here. On the black nails, it's a little bit difficult, so you kind of have to go slow on those. You want to look for when the nail starts to arch. That's usually a pretty good indicator. So we will go ahead and take a little bit off of there, a little bit of there. Go. And we want to wait to see that black dot in the middle there. That's how we know we're getting close to our quick. If we were to quick him, we have quick stop here. So if he were to quick and bleed, we would take our quick stop, pour a little into there, and then we take it and dab it on the exposed quick to stop it from bleeding. You can also use cornstarch. A feline nail trim on Basil. So in order to trim a cat's nails, you have to locate the toe and apply a little pressure behind the nail to extract the nail. So then we're going to go right up into the quick here. Cat nails are clear, so it's easier to see those. And you'll trim right there. You'll do that for all these other ones also. It's okay. He has hairy toes, so it makes it a little more difficult to hold on. You will apply that pressure to extract the nail. And then if you were, make sure you get the dew cloth. These trimmers are not the best. And then we also have our quick stop in case you were to quick him, in which case you would apply a little bit into the lid and tap that to the nail that was bleeding. Okay, today we're going to be administering a pill on Willow here. So she's not an actual medication, so we are going to be using a pill pocket. So to pill a dog, we're going to have her spin around here. Sit. You will grab her top jaw with your top hand, take the pill, open, put down, close her mouth, rub the base of her esophagus, make sure she swallows, and then we want to follow it up with some water to make sure we don't get an esophageal stricture. Today we're going to be administering an oral medication to Basil here. So we have our pill pocket, which will contain our pill, and we have our syringe with water. The reason you want to follow up with water after pilling an animal is so you don't get an esophageal stricture. And to make sure that it's getting all the way down and it's not getting stuck in there. Preferably, mostly we do that with capsules, but it's best to do it with all medications. So we're going to take our fingers behind his canines, take our pill, pull back, down, then we're going to hold the mouth and rub his esophagus, and then we will give a little bit of water.